Newsday continues here on One News Now. I'm Jess De Los Santos. The COVID-19 reproduction rate in Metro Manila has dipped to 1.23 from 1.88. To help us make sense of that number, Professor Guido David of the OCTA Research Group is now joining us live via StreamYard. Good afternoon, sir.
Yes, hi. Good afternoon, Jess.
Okay, sir, 1.23 reproduction rate. If I'm not mistaken, that number exactly is what we had prior to the reimposition of the ECQ, just when we were seeing the surge. So give us an idea first, what does this mean exactly?
Well, it means that the trend has gone down. What that means is the increase in cases has actually decreased in terms of percentage increases. In fact, compared to the last week, we have a negative growth rate in the NCR for the first time. I think it's minus 4%, if I'm not mistaken. But we have a small negative growth rate. But the overall trend is not yet a downward trend, and it's still greater than 1. So, but what it means is the ECQ did have a significant effect on reducing the upward trend in cases, and now we're close to having a flat trend.
But then again, we still should at least expect a high number of cases in the days to come. Is that correct?
That's correct. It doesn't mean that the cases are already starting to go down. They may still be plateauing, or if they may be decreasing slightly. So we will still expect around the same range between 9,000 to maybe up to 12,000 cases in a day. But hopefully this will start to come down soon, I mean, within the next few days. So at least we'll have a lower base number. In the NCR, we're right now averaging less than 5,000 cases per day. We were averaging more than 5,000 just last week. So I think this is a big improvement. And what we're also seeing is that some cities in the NCR are starting to also have a negative growth rate. Cities like Pasay and Marikina have significant negative growth rates. So it means that the trend has improved in many cities, but overall in the NCR, we still have a little work to do.
But then again, one point here that's very crucial, I think, with the report is that you also did mention that the number of tests is 19% lower than the average during the week before. So how exactly did that affect at least the reproduction number?
Well, definitely it may have helped deflate the reproduction number slightly, but we're not seeing a big, we're not anticipating a big change in the reproduction number. I mean, it could have been decreased by about, for example, from instead of 1.23, it may have been 1.3 in actuality, but we don't think the difference is that big based on estimates that we're seeing. So yes, it's true, and bigger numbers are coming in. What that means is some of the backlog in testing has started to come in the data. So we already saw that yesterday that we tallied a significant number of cases. So I think we're starting to account for this backlog in the testing from last week.
Given that, when should we expect the real reproduction number to at least come in? By next week, is that possible?
Yes, definitely. We may be seeing closer to the true value already by today and tomorrow, and definitely by next week.
Okay, Professor David, which cities or areas in NCR Plus have shown great improvement in terms of the infection growth rate, and what particular measures should we commend? Well,
we're seeing right now, at least compared to the previous week, we're seeing a significant improvement in Marikina. They used to be, I think, in the top 10 in terms of new cases. Now they're down to number 17. There's also a significant improvement in Pasay and Mandaluyong. And there's some slight improvements already in some of the bigger LGUs like Taguig, Makati, Quezon City, and Manila, and Las Piñas. So, of course, these LGUs have different ways of approaching the pandemic, although, of course, we have a sort of a unified system now. We have the NCR plus lockdown in the form of the ECQ. So definitely that has helped curb the growth rates in these LGUs. So I can't really single out an LGU for some of its best practices, but maybe we could learn from them. We could also learn from Cebu because they did have a good pandemic response for their surge from December to February.
Are there any areas of concern still?
The areas of concern, there are some areas in Calabarzon which are still having a significant increase. And aside from that, Baguio City is a slight area of concern, and same thing with Santiago in Isabela because the cases are increasing, but we hope that they could curb the increases soon. Their hospitals are also getting maxed out in terms of occupancy. Definitely in the NCR, our hospitals are also, it goes without saying that our hospitals have high occupancy at this time.
Okay, despite, of course, this low reproduction number, we do know as well that you still recommend the extension of the ECQ in the NCR Plus bubble. Can you nuance us more about that?
Well, the reproduction number has decreased, but that's the main indicator that has trended for the better. Right now, we're still having a high positivity rate of about 25% in the NCR and even higher in Calabarzon. So that's not very good. And we're also having high hospital occupancy rates. And that is the main problem. We could have many cases, but if we have cases who are not getting admitted in hospitals because they're full, this is a problem for the healthcare system and a problem for citizens who are unable to get healthcare. And that's why we recommended, just a recommendation that we could perhaps extend the quarantine, or perhaps another option is to reduce it to an MECQ, and we'll still have some health restrictions in place because we don't want the cases to get out of hand right now that we have already seen a significant improvement in the trend. So we want to, basically, we don't want to waste the gains that we have made these past 2 weeks.
Okay, and lastly now, very quickly, Professor David, for how long do you think should ECQ at least be extended?
Well, our group recommended 2 weeks. Personally, I believe that if we're seeing a significant improvement by next week, for example, if the reproduction number's already gone down below 1, we're already on the downward trend, then I personally wouldn't mind if we actually loosen the restrictions gradually so that we could open more business sectors. But of course, we would have to see what the trends are by next week.
Thank you very much for your time and insights. That, of course, was OCTA Research Fellow Professor Guido David. The Health Department reports over 12,600 fresh COVID-19 infections. That brings the country's caseload to above 853,000. Some 190,000 are still considered active. The virus claimed the lives of 225 patients in the past 24 hours, pushing the death toll to over 14,700. Some 648,000, meanwhile, have gotten better from the disease, with 593 new recoveries today. All 300 hotels in Metro Manila affiliated with the Philippine Hotel Owners Association are now fully booked. That means these can no longer be converted into isolation facilities for mild and asymptomatic COVID-19 patients. In today's Laging Handa briefing, PHOA President Arthur Lopez said their facilities have been turned into temporary lodging for returning OFWs. Recall that the Philippine College of Physicians has urged the government to convert hotels into additional quarantine sites. This comes as a surge in COVID-19 cases in Metro Manila and nearby provinces has left hospital beds at full capacity.
Now, to convert hotels to hospitals, I think that's gonna be very difficult. No? Kasi maraming kailangan ng hospital. Mas marami silang detalyang kailangan to support patients. Operating rooms, games, particularly. Okay, so I don't know. But ang problema, wala tayong mabibigay na hotel kasi kung hindi, kawawa naman ang mga OFWs natin.
In other news, the Foreign Affairs Department is now looking into reports of Chinese missile ships chasing after a TV news crew in the West Philippine Sea. Once confirmed, the agency says it will raise the issue with the Chinese government. The ABS-CBN news team reported on Wednesday that they were supposed to visit Ayungin Shoal aboard a Filipino fishing vessel when Chinese Coast Guard radioed them to ask what they were doing in the area. A Chinese ship chased them for an hour and was later replaced by 2 missile ships from the Chinese Navy. The news team was then forced to head back to Palawan. The DFA said it is thankful that the news crew were safe. It reminded the public to coordinate with authorities when planning to visit the Kalayaan Island group of the West Philippine Sea. But over Twitter, ABS-CBN journalist Chiara Zambrano said they were in communication with the armed forces before, during, and after the trip. Recall that some 200 Chinese maritime militia were sighted in the Julian Felipe Reef and its vicinity as of last month. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Jess De Los Santos. We are One News.